Hi, very good evening. So today's live session will have a different topic, right? Interesting dental facts, where I'll be sharing a few facts pertaining to our profession, and I'm sure they'll be interesting and intriguing as well. So before I proceed, so I have a set of 9 to 10 facts, so I'll be sharing them now. And also, as you know, today is World No Tobacco Day. Also, we'll discuss some information pertaining to the same, right? So let me know these two things, and then we'll proceed with our discussion. The first one, let me know if it is streaming fine or not. The second, is my voice audible, or do you want me to raise my voice? Yeah. Oh, very good evening. Okay, yeah, I'll try to raise my voice as much as I can, right? Okay, so before we proceed, once again, oh, very good evening, all of you. So, we'll start with this first fact, or rather, I can say the first question, since we're used to these questions and answers. So, let me present these facts in the form of questions. I think it will be even more interesting and more receptive comparatively. So, whenever you have a toothache, how do you treat a toothache, or how do you treat a pain which is originating from the tooth? Yeah, sure, I'll definitely raise my voice. So how do you treat a toothache? What suggestions would you give to a patient if he or her comes to you with toothache? Okay, you would suggest a painkiller. That's good. Yeah, apart from painkillers, any other suggestions that you would give to the patient in order to relieve him or her from toothache? So Lakshmi says she wants to find out the underlying cause. Okay. Gauri says access opening. So you would directly go for access opening the moment patient says toothache. Diksha says it depends on diagnosis. Ramya says put an ice pack, the most economical model to treat toothache, isn't it? Rohit says add some clove oil. Okay. Sujay says give a painkiller. Pandit says tea bag. Sarita says find the cause. Sangeeta says not to take too hot or cold foods. Okay, for future mishaps, Siddhant would recommend root canal treatment. Believe me, in medieval Germany, the only cure for a toothache was to kiss a donkey. It was practiced in medieval Germany. In order to relieve toothache, the person has to kiss a donkey. So forget about painkillers, clove oils, root canal treatments, access openings, etc. Right? Yeah, analgesics, Reneras. So toothache, it's a general question. So depending upon the cause, depending upon the diagnosis, we have different modes of treatment, right? Pharmacological management, non-pharmacological management, surgical management, isn't it? But the fact which I wanted to share here is kissing a donkey. So in medieval Germany, the only cure for toothache was to kiss a donkey. And by the way, I'm sure you'll not suggest the same to your patient, or else they would kick you back. Okay, the second one, a general question which I'm sure most of you would answer real quick. So, how much time should a person spend on brushing his or her teeth on a daily basis? Just give me a rough estimate. Or how much time do you think should you personally should spend time on brushing on daily basis? So do you want options? 1 minute, 2 minutes, 5 minutes, 10 minutes. So which one would you choose? Dainty maids, yes. Kissing the donkey definitely might help in shifting the pain to donkey. 2 minutes each time, 3 to 5 minutes, 2 to 3 minutes, 1 minute, 2 to 5 minutes. Ideal. Vajinath says ideal is 2 to 3 minutes. Sarita says 2 to 3 minutes, twice a day. Okay, whatever it is. We say ideally 2 minutes, right? Around 2 minutes. Based on studies and based on analysis given by various studies, an average person spends 38 to 40 days brushing their teeth over their lifetime. That's more than 1 month continuous if you try to add up all the 2-minute intervals on daily basis, assuming that a person would survive for 60 or 65 or 70 years. An average person would spend 38 to 40 days. That is almost 1.5 month during his or her entire lifetime only on brushing his or her teeth. So now decide how much time you should spend on brushing. Yeah, 2 to 3 minutes would be ideal, isn't it? Okay, let me ask you one dental anatomy related question. Which tooth do you think is the largest in the entire oral cavity? We'll talk about permanent dentition. So which permanent tooth do you think is the largest in the entire oral cavity in case of humans? Yes, Lakshmi, 40 days seems to be very huge. Maybe we can save some time so that we can allot the same towards preparation. Yes, so depending upon the dimensions, we say mesiodistally, mandibular first molar, buccolingually, maxillary first molar. Okay. Wonderful. So it is a molar, right? So it is a molar. That's true even in case of elephants. An elephant molar is 1 foot across. Just imagine 1 foot. And each molar weighs 9 pounds. You know, 1 pound is approximately 0.45 kgs, and the weight of each molar is 9 pounds, and it is 1 foot across in dimensions. So now compare and see how huge the animals are and the oral cavity is. In fact, we'll be going through the number of teeth and sizes of teeth in other animals as well. It will be really interesting. And fourth one, let me ask you this general question. Assume that you are meeting a new person. You're coming across someone whom you have no idea about. So what is the first thing you notice in that particular person? For example, we two are meeting. So what is the first thing you would observe in me, or what is the first thing I would observe in you? I mean, the person has come to you, what is the first thing you would observe? Yes, Abhishek, definitely we need a drill machine to perform RC. So is it smile line or is it teeth? Can you be more specific? Because most of you, Abhishek, Ramya, Lakshmi says smile arc. Sarita says teeth. We'll leave about dentists. We're not just talking about dentists. In general, a person, a layman, a common man has come across another new acquaintance. What is the first thing he or she would observe in the other person? Okay, as per one of the studies published in USA Today, 47% would observe smile, 31% would observe eyes, 11% would observe or would go for the smell, 7% clothes, 4% hair. So vast majority, the first thing they would observe is the smile and teeth. So now it shows how important a dentist is in one's personal life. Almost 40% or more than 40% would observe teeth and smile. The first thing they would notice in a person. And obviously, when coming to dentists, the first thing we would say is obviously the teeth, since we're used to them. But even common men, right? Common man and woman, the first thing they observe in a new person is their smile. Yeah, and then comes all this face, personality, the way of dressing, hair, and whatnot, many other things. Okay, good. So, we're all using toothpaste. I'm sure you're all brushing on daily basis, and I'm sure you'll be using some kind of toothpaste. It doesn't matter which company it belongs to. So, prior toothpaste, what were all the materials that were widely in use, especially by our elders, to keep their mouths clean? So before toothpaste, which materials were used to maintain oral hygiene? So what would you answer? Yes, Anusha. Anusha says coal. Good. Charcoal twigs, neem stick. Yes. Ash, baking soda. Yes. Coal, neem stick, brick powder. Good. Salt. And nowadays we're again coming back to the same formula. Most of the multinational companies involved in manufacturing toothpaste are coming up with these new formulations like charcoal in toothpaste, salt in toothpaste, sugar in toothpaste, and in future we'll definitely have even masalas in toothpaste. Sand, was sand used, Abhishek? I was not sure, because even I used to hear my parents saying that during their childhood they used ash or coal or even baking soda in order to have that whitening effect. So before toothpaste, people used charcoal, chalk, ashes, honey, lemon juice, etc. to clean their teeth. So toothpaste is really saving us from using all those things. And as I said, in fact, we're going back in time by incorporating charcoal and salt again in our modern day toothpaste. Yeah, dant manjan or whatever, right? Yes, sugarcane, even sugarcane or neem stick. Exactly. Mango cashew nut leaves. Okay, I was not aware of it. Gauri, thanks for sharing. Diksha says walnut tree leaves. Okay, Vaishnath says during his childhood he used to use Vico powder. Okay, good. Right. Now another question pertaining to your personal cleaning habits. You all brush your teeth, right? So how many of you brush twice a day? At least twice a day. So among the 42 or 43 who are watching this live, how many of you would brush your teeth twice a day on regular basis? When you brush thrice a day, it's called as OCD. So I'm just kidding. Good thing. Okay. See, as far as I know, most of us do brush once a day. But if you're brushing twice a day, it's fantastic. So we brush twice a day, and we should gargle after having some food or snack item, as you know the reason. But how many of you would floss your teeth on daily basis? I mean, you should be sincere in answering this question. How many of you floss on a daily basis? I don't personally floss. See, And I'm sure most of you would use a floss whenever something gets stuck in your teeth, isn't it? And I even doubt that. Maybe you might be using some pins or toothpicks and create wider spaces. Yeah, floss is something which we are not used to, isn't it? Why is Ramya lucky? Okay, Ramya has space dentition. Okay, you're definitely lucky. Okay, you know what? If you're missing flossing, it means you're leaving almost 35 to 40% of tooth surfaces left uncleaned, right? Including me. So if you don't floss, you're missing cleaning 35 to 40% of our tooth surfaces. So maybe this fact at least should make us floss, if not on a daily basis, at least on weekly basis, isn't it? Because as healthcare providers, we should follow certain things before we start prescribing the same to our patients, isn't it? As Arjit rightly said, most of us do floss only after having non-vegetarian food. I appreciate your frankness, Arjit. Yeah, especially proximal caries and all, it prevents plaque accumulation in proximal areas. Good. Okay, tell me one thing, Franklin. Just put your hand, put your palm, right palm on your heart and just answer this question. How many of you brush regularly? I do brush regularly. I do brush at least once a day. How many of you brush regularly? Come on, you did not even answer this question. I'm just kidding. Okay, I'm sure you'll be brushing because we brush so that we can have a breakfast. We don't brush for sake of personal hygiene, and I'm sure of this. 99.99%, and if I'm wrong, even 100% would brush so that we can have a breakfast. Not because we're concerned about our oral health, isn't it? Be frank. Ramya says she doesn't even take water without brushing. There are people who have the breakfast, lunch, and dinner even without brushing their teeth. Okay, fine, fantastic. So, if you don't floss, you'll be missing 35 to 40% of your tooth surfaces. You'll be leaving them unclean, right? You're literally not touching them, especially the proximal surfaces. Good. Now, we should particularly feel proud of this particular fact. Which is the hardest substance in the body? I know you know the answer, but I want to hear from you again. Which is the hardest substance in the body? And I said we should be proud of this. Exactly, exactly. Enamel is the most mineralized tissue in the body, more than 96%. And also, it is the hardest substance in the body. We are aware of this, but we should recollect these facts so that we would feel proud of, isn't it? So tooth enamel is the hardest and highly mineralized substance in the body. Fantastic. Okay. Now, coming to two variations, I'll talk about an animal which is too huge and also about another animal which is too small in terms of sizes, and also we'll talk about the dentition. You know about shark, right? Sharks lose their teeth almost every week, and some can have as many as 20,000 teeth in their lifetime. So it's like they have the new teeth almost every week, and some sharks can have as many as 20,000 teeth during their lifetime. I mean, not all at once, but because of this continuous shedding process, maybe that's possible. And now coming to the opposite, in terms of size, shark is a huge fish, isn't it? Coming to snail, the snail's mouth is almost equal to size of a pinhead. A snail's mouth is no larger than the head of a pin but can contain over 25,000 teeth. See, irrespective of the size, you can see the diversity and the enormous variation. In spite of variation in size, you can find that even in case of snails, in spite of having a very small head, they still have large number of teeth. It's only a matter of size, and that's the beauty of our nature. So shark versus snail. Yeah, Lakshmi, just don't worry about the sequence, right? You will get it right. Okay? I'm sure you'll answer this question right. So don't worry about the sequence, like which is harder, enamel, dentin, bone, or whatever. Just go by the hardness values and cool. Yeah, yes, definitely. These animals don't need a dentist because it's only humans who resort to very bad habits, like the kind of junk we consume, the kind of brushing habits we have. Definitely, we do need dentists, but not animals. I always wonder why. Take for example, our pets like dogs have no dental issues. I mean, they might have some halitosis or whatever, but they somehow seem to be healthier, seem to be having healthier oral cavities. Why are we more concerned and why are we more worried about? It's because of our thinking and because of our brain capacity. Maybe we seem to be having more problems than other animals, isn't it? So this brain, in fact, is helping us create more problems than solutions. Yes. Now, you know what? When you compare the number of teeth, giraffes and humans have the same number of teeth, right? Another interesting fact pertaining to number of teeth. Giraffes have the same number of teeth as humans. You just keep that in mind. Now, I found another interesting fact pertaining to the ability of our masticatory muscles to produce the forces, especially in the posterior teeth. Studies have shown that jaw muscles are so powerful, they are so strong that they provide about 200 pounds of force when bringing your back teeth together in the process of chewing or clenching. It means we are generating a force of around 200 pounds. For comparison, for sake of comparison, let me give you one example. You know martial arts, kung fu and all martial arts, right? So in martial arts, the punches which are used, they produce or deliver an average force of 300 to 400 pounds. And you're almost creating or producing half of that force using your masticatory muscles. So imagine the amount of force that you're generating using your masticatory muscles. So that's another interesting fact which I found. And in order to have the comparative analysis, I mentioned about martial arts punches as well. So we're generating an average of 300 to 400 pounds in martial arts punches. It's like almost half of the force is being generated by these masticatory muscles. Just imagine how powerful the jaw muscles are, isn't it? Dentimates, you have never seen a giraffe in my life, even me for that matter. Okay, so these are some of the facts which I wanted to share. And since today is World No Tobacco Day, so March, April, May. So I've been waiting for the past 2 to 3 months. May 31st, 2019 is celebrated or observed as World No Tobacco Day. So if at all there is a question from the same in NEET MDS 2020, don't blame me saying that I haven't discussed this, because last time there was a question on WHO theme, right? World Health Organization, like you have your International Health Day, and there was a question on the theme which we discussed during our paper discussion videos. So May 31st, 2019. So every year, right, May 31st, we do observe the particular day as World No Tobacco Day. So I'll be giving you some facts pertaining to this. So 2019, the focus of World No Tobacco Day 2019 is on tobacco and lung health. The campaign will increase awareness on the negative impact that tobacco has on people's lung health, from cancer to chronic respiratory disease, the fundamental role the lungs play for the health and well-being of all the people. The campaign also serves as a call to action, advocating for effective policies to reduce tobacco consumption and engaging stakeholders across multiple sectors in the fight for tobacco control. So this is some information given in WHO website, and it clearly says that the focus of World No Tobacco Day 2019 is on tobacco and lung health. Just keep those words in mind, and also I suggest you to refer WHO website, which is free and accessible for each and every one of us. And before I conclude, few interesting facts. In fact, unfortunate to come across these facts, but facts are facts. Facts about tobacco. In fact, assuming that the world population is 7 to 8 billion, almost 1 billion consume tobacco, either directly or indirectly. Tobacco kills up to half of its users. For example, if 100 are smoking or using tobacco, 50 will eventually die because of consequences of tobacco usage, which is very unfortunate. So tobacco kills up to half of its users. Second, tobacco kills more than 8 million people each year. More than 7 million of those deaths are the result of direct tobacco usage, while around 1.2 million are the result of passive smoking. That is, non-smokers being exposed to second-hand smoke. It's not that only when you consume the products directly that you will be affected. Even a person in a family, definitely the family is going to get exposed to this second-hand smoking. So even that contributes to almost 1 million deaths per year, which is very alarming. So tobacco kills more than 8 million people each year, more than 7 million because of direct usage, and more than 1 million because of this second-hand or passive smoking. And surprisingly, as I said, around 80% of the world's 1.1 billion smokers, so almost there are 1.1 billion smokers, more than 100 crore. Among them, among the 100 crore, more than 80% live in low income and middle income countries, which is again a very unfortunate thing, because having said that, these are low and middle income countries, and people are getting used to these kind of habits, and it's like a self-sustaining detrimental model affecting public health, which has or which puts a lot of burden on the government in those particular communities to take care of the people's health, ultimately affecting the community overall. So these are some of the facts which I wanted to present, especially as it is May 31st, and I'm sure you would remember them. And also I would suggest you to go through WHO website, and you can find plenty of information over there, and make sure that you enter all these points, especially the points pertaining to World No Tobacco Day, in your customized notes, because it will be helpful for you, not just as a general knowledge, but also in your exam as well, right? So these are the things which I wanted to present in this live session, and you have any further questions, you can always get back through mail, and I'll just stay live for another few minutes and then we'll conclude the session, right? I hope I was audible, and I'm sure with earphones it would be much more better. Since it's live, I have this constraint of not using a microphone, but with earphones I'm sure it will be comparatively better. I'm also changing the title so that those who are watching the video without earphones wouldn't curse me. So please use earphones for every live session, okay? Yes, even passive smoking is detrimental, definitely. Neha says, yes sir, we have this question in university theory paper, also in PCD. Okay, that's good. Okay, now tell me, how many of you were focusing on the television reflecting in the mirror, or were you involved in this discussion? Because I just noticed that there is a reflection of the tennis match that's going on. No, that was intentional. I put that intentional so that I could ask you this question. I wanted to make sure, like, what you are actually following. Utkarsh, we're done, right? We're done with the facts presentation. So I'll make sure that the sessions are not more than 20 to 30 minutes time so that there wouldn't be any passivation. Last 5-10 minutes, it's all up to you. You can just stay live or you can just jump off because it will be more or less like a general interaction. Yes, very glad to hear. And yes, missing toffee, definitely. Definitely, we are missing toffee. And I'm sure you're also missing toffee. Lakshmi, when am I returning? Not so soon. I'll be staying here for a few months and I haven't yet decided, Lakshmi. Yeah. Yeah. I think Ronald, yeah, Nadal is playing now. Roland Garros, no, I'm not sure of it, Supratim. Yes. Yes, Pranavi, regarding tips for university exams, you can just get back through mail. I'll give you some suggestions in the form of a text message, right? I know it's exam time. I'll definitely make some videos on the same. I'll definitely make some videos on various tips or various things you need to follow while writing a theory paper. You'll have them soon. And you need any further assistance, you can get back through mail anytime. Right? So it's almost the last day of May, and if you had started your preparation in December or January, it's like almost halfway through. So it's just another 6 months time or maximum of 7 months time. Never give up. You might feel demotivated, you might feel passivated now, or you might feel like giving up. But remember, those who just hang on will just definitely get through it with wonderful and outstanding results. It's all about hanging on, because I personally had this experience during my plus 2 as well. In spite of having an easy paper comparatively during our state entrance, during plus 2, because of fear and anxiety, I just left my preparation altogether. And my friends who were doing reasonably good could score extremely well. So it's all about hanging on, right? So do not feel disappointed. It's not. You see, we have many expectations. We feel like we should complete the entire syllabus. We feel like we're not able to follow a schedule perfectly. But that perfect word is very dangerous. In fact, we all strive for it, but it's very dangerous, because once we feel like we are derailed from that perfect process, we feel like we should stop everything at once. But believe me, it's all about cumulative work which you put. So cumulative effort on consistent basis, no matter how it is, no matter how your scoring rates are, it doesn't matter. But if you just hang on and you just give your best consistently from day one, or at least from today, without giving up, only having that positive thing in mind. And I'm sure it's not so easy to stay motivated and to stay positive throughout your preparation phase, and that's exactly the reason why I've been doing these live sessions, and I've been asking you to stay in touch so that we can discuss and incorporate some positives in your preparation. Having said that, intrinsic motivation is the key. Just question yourself why you're preparing, and what is that you want to achieve, and what is that you're trying to do on day-to-day basis. see to that you're giving your best each and every moment. And one final phrase I would say, you enjoy what you're doing, you need not worry about anything else, not even scores or ranks. You just enjoy the process, you will get the best possible outcomes. You just enjoy learning. It happens only when you know the importance of what you're doing, as I keep on saying. Just focus on enjoying the process, stay process oriented, you'll have wonderful results. Take my word. So when you enjoy the process, you'll not feel stressed. When you enjoy the process, you won't get demotivated, you won't get frustrated, and you don't even bother about the results or scores which you have been getting, because for you a more score is a boost, a low score will act as even more powerful motivator so that you can learn from that particular test. So even if you're not performing, or if you feel like you're not performing well in a particular test, it is an opportunity for you to improve. Now is the opportunity, not in the day of exam, right? So no matter how many mistakes you make, this is the only chance you have. So make maximum use of it, be smart enough, and there is no point in getting demotivated. If you feel frustrated, you feel like giving up, if you can't help yourself, then who else is going to come and help you? Maybe someone might come and help you, maybe family or guides can come and help you, but who is going to help you in your future when you're facing even more greater challenges? So consider this exam as a minor challenge, an example of a minor challenge, and believe me, you're going to face numerous other challenges in life. So you have to help yourself first, and definitely you need some guidance. I'm always there. As I keep on saying, I'm just a mail away. Enjoy the process, everything falls in place, you will feel motivated. And one best thing you can do whenever you feel low is imagine yourself to be the topper, right? I personally follow the same. So once you imagine yourself to be the topper, it's like you want to achieve that. So how would you feel, how would your loved ones feel, how would your family feel, and how would everyone around you feel? So those kind of positive things. So these things will definitely help you stay engaged in your preparation, and they help you stay focused. They help you stay intrinsically motivated, right? So keep these things in mind. Never mind, I'll be repeating the same time and again. It's like daily dose of motivation. It's like you bathe, or you go for bathing or cleaning on daily basis. So this is something like that. This is essential on daily basis, in fact. And you'll definitely be getting all of this through our live sessions, e-classes, test series, as well as study club discussions, right? So if you have any further questions, you can always get back through mail. And as I keep on saying, I'm just a mail away. So wish you all the best. Love you all. Have a great night, and see you again this Sunday in another general live session. Okay? Now, take care. Yeah, Pawan, anyone, you have any further questions, you have any further concerns, you can get back through mail. I'll definitely reply within 24 to 48 hours, right? See you. Bye. Yeah, and I forgot to mention this. So before you sleep, make sure that you're having that sense of satisfaction. See, it's almost 1:40 a.m. now. The reason why I'm conducting this live session, even though it's very late, is because if I sleep without conducting this live session, I would feel low, I would feel dissatisfied. Maybe that word is not correct, but I would feel demotivated. So make sure that you're satisfied with your day by the time you go to bed. And when you feel you're satisfied, that's the right time to go to bed. It can be any time based on your convenience and time availability. And every morning when you wake up, if you have that sense of excitement that today is an opportunity to learn new things in the form of discussions, e-classes, test series, or whatever, if you feel excited, so consider these two signs and symptoms as very vital. Sleep with satisfaction and wake up with excitement, and you'll have the best days possible. not just in preparation phase, but take anything in general. You're going to have best days if you have these kind of signs and symptoms.